Nurses are often the first responders in a crisis, providing immediate care and support to those in need. Their training equips them to assess situations swiftly, prioritize care, and deliver life-saving interventions. But their role extends far beyond the immediate crisis. Nurses provide ongoing support and education, helping individuals and families navigate the aftermath of a traumatic event. Their dedication and expertise are crucial in mitigating the impact of crises and fostering resilience in the face of adversity. A crisis is not merely a stressful event. It's a point where usual coping mechanisms fail, leading to intense emotional distress and an inability to function normally. Understanding the different types of crises is paramount in providing effective care and support. One type is a situational crisis, often sudden and unexpected, like a severe accident, a job loss, or the death of a loved one. Then there are developmental crises, which occur as part of the normal flow of life, transitions like starting school, leaving home, getting married, or retiring. These life changes can trigger anxiety, stress, and a sense of being overwhelmed as individuals adapt to new roles and responsibilities. Finally, we have existential crises. These crises often emerge in response to significant life events such as a brush with death, a major health diagnosis, or a profound personal loss. Recognizing these different phases of crisis allows nurses to tailor their interventions and provide support specific to the individual's unique needs. Crisis intervention techniques aim to reduce immediate emotional turmoil, regain a sense of control, and develop coping mechanisms for moving forward. Active listening, for example, is a foundational tool demonstrating empathy and fostering a sense of being heard. It involves truly listening to the person's words, paying attention to their nonverbal cues, and reflecting back on their feelings to ensure understanding. Then there's validation, which involves acknowledging and accepting the individual's feelings without judgment, even if those feelings seem irrational or exaggerated in the moment. Validation doesn't mean agreeing with the person, but rather showing them that their feelings are valid and understandable given their situation. Reframing is another key technique, which helps individuals shift their perspective on the crisis. It involves gently guiding them to see the situation from a different angle, identifying potential opportunities for growth or learning amidst the challenges. Problem solving focuses on empowering individuals to regain a sense of control. It's about collaboratively exploring potential solutions, breaking down overwhelming problems into smaller, manageable steps. Finally, referrals to mental health professionals or community resources are crucial when further support is needed. Crisis intervention isn't about having all the answers, but about providing immediate support and connecting individuals with the resources they need for long-term healing. The psychiatric unit is often the environment where nurses face unique challenges in crisis intervention. These settings deal with individuals experiencing acute mental health crises, often involving suicidal thoughts, self-harming behaviors, severe anxiety, or psychosis. Nurses in these units need specialized skills and a deep understanding of mental health disorders to provide effective care. They must be adept at de-escalating volatile situations, managing aggressive or unpredictable behaviors, and recognizing subtle signs of distress. The stakes are high, demanding quick thinking, sound judgment, and unwavering composure even in highly stressful situations. Furthermore, building trust and rapport is paramount in psychiatric crisis intervention. In the psychiatric setting, crises can erupt suddenly, demanding swift and effective intervention. Agitation, for instance, is a common manifestation of crisis, characterized by heightened anxiety, restlessness, and potentially aggressive behavior. Nurses must remain vigilant, recognizing early warning signs and employing de-escalation techniques to prevent the situation from spiraling out of control. Aggression, on the other hand, poses a more direct threat, often fueled by fear, paranoia, or a desperate attempt to regain control. Here, nurses need to prioritize safety, both for themselves and other patients, while simultaneously addressing the underlying emotional distress driving the aggressive behavior. Self-harm and suicidal ideation are perhaps the most heart-wrenching crises encountered in psychiatric units, signaling profound despair and hopelessness. Nurses play a critical role in assessing suicide risk, providing immediate support and implementing safety plans to mitigate the risk of self-inflicted harm. Overdose, whether intentional or accidental, is another critical situation demanding immediate medical attention. Nurses must act swiftly, administering necessary antidotes, monitoring vital signs, and providing supportive care to stabilize the patient's condition. Hallucinations, while less predictable in their manifestation, can be equally distressing for individuals experiencing them. Nurses need to approach these situations with sensitivity and understanding, validating the individual's experience without reinforcing the delusion. Crisis intervention in psychiatric settings involves a multifaceted approach. Building a therapeutic relationship is paramount. This involves establishing trust, rapport, and a genuine connection with the individual, creating a safe space for them to feel heard and understood. Assessment is the cornerstone of effective intervention, allowing nurses to gather critical information about the individual's mental state, triggers, and support systems. De-escalation techniques are crucial for managing agitation and aggression, aiming to reduce emotional intensity and prevent the situation from escalating further. These techniques include verbal de-escalation, using a calm and reassuring tone of voice, active listening, and offering choices to empower the individual. Medication management is another vital aspect, ensuring individuals receive appropriate medication to manage their symptoms and regain emotional stability. Environmental modifications can reduce stimulation and promote a sense of calm. Grounding techniques are invaluable tools for managing anxiety and overwhelming emotions. These techniques help individuals connect with the present moment, redirecting their focus away from distressing thoughts or feelings. Distraction techniques, such as engaging in a simple activity, listening to music, or talking about a neutral topic, can also be helpful in diverting attention away from the crisis and promoting a sense of calm. Post-crisis care and recovery. Post-crisis care is just as crucial as the initial intervention, focusing on supporting the individual's recovery and preventing future crises. This phase requires a shift from crisis management to long-term support and healing. Debriefing is an essential first step, allowing both staff and patients to process the experience. For staff, it's a chance to discuss what went well, identify areas for improvement, and provide emotional support to one another. For patients, it's an opportunity to reflect on the events leading up to the crisis, identify triggers, and discuss coping mechanisms for the future. Thorough documentation is vital, creating a record of the crisis, interventions used, and the patient's response. Follow-up care is paramount, connecting individuals to resources that can support their continued recovery. This might include therapy, support groups, medication management, or connections to community resources. The goal of post-crisis care is not simply to return to a pre-crisis state, but to emerge stronger and more resilient. Ethics in disaster nursing. In crisis intervention and disaster nursing, ethical dilemmas often arise. Nurses must navigate these complexities with sensitivity, integrity, and a deep respect for the dignity of every individual. One of the paramount ethical principles is autonomy, respecting the individual's right to make their own decisions, even in crisis. This can be particularly challenging when individuals are experiencing impaired judgment or posing a risk to themselves or others. Balancing autonomy with beneficence, the duty to act in the best interests of the patient, requires careful assessment, open communication, and collaboration with the individual and their support system whenever possible. Justice dictates that all individuals, regardless of their background, beliefs, or circumstances, deserve equitable and compassionate care. In disaster situations where resources may be limited, nurses face the daunting task of allocating care fairly, prioritizing the most critical cases while ensuring no one is unjustly denied access to life-saving interventions. Confidentiality is another cornerstone of ethical practice, safeguarding the privacy and trust that are essential to the therapeutic relationship. However, in crisis situations, there may be exceptions to confidentiality, particularly when there is an imminent risk of harm to the individual or others. These ethical dilemmas highlight the complexities of crisis intervention and disaster nursing, underscoring the need for ongoing reflection, open dialogue, and a commitment to upholding the highest ethical standards in the face of extraordinary challenges.